Hi, this is Jen Rubin, editor-in-chief of The Contrarian. We are delighted to have back Neera Tanden, who is the president and CEO of CAP. Before Neera joined us, we were just joking that we first met and sort of bonded over the last time Republicans were seeking to rip healthcare away from the American people in order to pay for for tax cuts for billionaires. Welcome, Neera. And they're at it again. Why have they
Great to be with
Nothing
you.
ever changes. It's if they can take health care away from them, it's a good day for them. That just puts a spring in their step. What have they come out with on the House side as they're going through all these machinations to come up with something that they think they can actually sell to their members and the American people? What's their
Well,
latest idea?
the latest is they have a variety of proposals that will strip healthcare away from 13.7 million people. That's people who have healthcare today will lose healthcare because of the policies of the Republicans. What's really crucial to understand is that all of this is in service of a plan to fund a massive tax cut, the vast majority of which goes to the wealthiest Americans in the country. Billionaires will get a tax cut, a pretty significant tax cut, and their plan is to use money that pays for people's doctor visits, to pay for asthma visits, the basic health care that working class people, they want to make the Medicaid program something for people that are, just poor, who don't work. The vast majority of people on Medicaid are working or in training or basically getting training for a job. So 90% of the people on Medicaid, over 90% of people on Medicaid are working or working to get a job. And so that's why this is what is so shocking about this is that it's so blatant a redistribution of wealth from working class Americans who are, by the way, already paying for Trump's tariffs, working class Americans to the wealthiest people in our country. And it can be stopped. There's a lot of challenges. Um, 8 years ago, you and I, right now, we're in the throes of fighting the repeal of the Affordable Care Act. A lot of people said that fight was inevitable. Republicans said all throughout they were going to pass this bill, no problem. And there are more problems with this legislation than that legislation. And so the most important thing to remember is all of us have agency to fight this.
Absolutely. Now, just to give people a sense of how enormous Medicaid is, last time I looked, there are about 79 million people, including children who are on the so-called CHIPS program, CHIPS, that get health care. So when we're talking about these cuts, we're talking about 13 of 80 million people losing their health care.
Yes, yes, we're talking about a gigantic chunk of people losing their health care. And let's talk about why. So basically, they're trying to redesign the program and basically cut people off, create systems where there's so much paperwork that people have to, like, in confusion, lose their care. These are all strategies by which they say they're really not changing the program, but they're really doing everything they can to drop coverage. And why? The reason is they're trying to save money to the program, save money. So they have to drop people. They're going to have all these ways they're describing it, but fundamentally, they're dropping people's health care so that they can have money for their budget targets. And that is really the most insignificant thing. The budget targets are really about how much money they can squeeze from the Medicare program, and they'll say waste, fraud, and abuse. That's just cover for people losing their care, and how much they can squeeze from this so that they can pay for tax cuts for the wealthy. But the most important thing about this is it's not like this is even, um, non-deficit funded finance. They are still going to run up giant deficits for their tax cut.
That's right.
That is still like we're still going to have longer term interest rates. In a way, this is just a level of cruelty. And I think the truth is the reason why this is, I think people can see through this is because, again, this is not the first like time we're at this rodeo. 8 years ago, they wanted to take people's healthcare away from the ACA. This is a very similar fight. Now they're after the Medicaid program. They think it'll be easier to get at because people think Medicaid is for poor people. The truth is, Republicans, Democrats, independents use Medicaid, and that's why you're seeing people like Josh Hawley. Not a big fan of Josh Hawley, but he is absolutely right that this gutting of Medicaid is taking health care from working class people in this country. These people, they claim to talk every election. They act like they're for working class people. And look at the double whammy these guys, that working class people of America are getting from Trump and the Republicans. Not only are they going to take away their health care, but they're keeping these tariffs on people who need to pay for that car seat, who need to pay for that soccer ball, who need to pay for that extra couple of dolls for their kids. And they're going to pay what amounts to essentially a kind of a version of a national sales tax. So it's a double whammy on working class people of this country.
Exactly. And just to stress 2 points. First of all, we are looking at hundreds of billions. That's a lot of money, but hundreds of billions in cuts for Medicaid. But to what Neera said, we're talking about trillions in tax cuts. And as Justin Wolpers explained to us the other day, that's like 12-point type and a football upright. That's the difference. So they are cutting, which is the heart and soul of people's health care, but it's a tiny fraction of what they're going to overspend in tax cuts for very rich people who, frankly, have not needed them. Let me ask you why it is that they haven't gotten this done. After all, Republicans run everything. Why are they having so much trouble coming up with this?
Yeah, so I do think because this is so frankly gross, right? There is a lot more concern because I do think there are members, there's some senators even who recognize that they talk this big game come election time and attack Democrats for not supporting the working class while they're basically about to honestly just screw them over. And I think there are people who recognize that that's a problem. And so there has been a lot of friction. I personally think that Trump spent all his political capital on these illegal EOs, executive orders, that great coalitions of people have stood up opposition to, and the courts are really striking down. And, he has left to later the legislative process and when he is much less popular. So this gives us an incredible opportunity. This is really the fight of our lives. If you want to stop Trump today, the thing you should do is call your member of Congress and tell them it is unacceptable for them to cut 14 million people's health care to serve a giant tax cut for the wealthy. We can all agree on maintaining middle-class tax cuts. In fact, Democrats have put up votes already to say, we'll agree on tax cuts. We just shouldn't have tax cuts for billionaires or multimillionaires. And Republicans have voted those efforts down. So the issue in front of us is really this very basic question. There's going to be all kinds of obfuscation, but should we drop people's health care for tax cuts for the wealthiest Americans? And I think, 80-90% of Americans think that's wrong.
And one thing you mentioned, Josh Hawley doesn't like this. And one of the reasons is because he comes from a state that has a lot of people who live in rural areas. Rural hospitals survive on Medicaid. And if this goes through, you're going to have rural hospitals, one after another, closing. And when that happens, people won't have health care for hours and hours away. They'll be driving for health care. And when a rural hospital dies, it's very common that that entire town is often the biggest employer. The entire economy of that region goes down the drain. And that's what we're looking at. Now, Neera, one thing I remember very well, because you were part of the brains behind this, is people have a hard time thinking 14 million people.
Yeah.
But congressmen have a way of understanding how many people in their district are going to lose health care. Is CAP going to be doing anything in that realm this time around by any chance?
Yes. So we're constantly updating our numbers, and we've put out district by district numbers with
Yep.
the overall cut when it was $850 billion. Now it's $750 billion. A little bit better. Not great overall. We will be producing district by district analysis. And why that's really helpful is we'll put that out. You'll be able to get it on our website, but we'll also put it on digital channels. It's really helpful to call members and confront them with the actual numbers of people who will lose coverage when you're talking to, say, a Mike Lawler, and it's 40,000 people in his district per se that will lose healthcare. I think that it's really important for people to remember that Medicaid is not a Democratic program or an independent program or a Republican program. Today, lots of Republicans around the country are on Medicaid. In Mike Johnson's district, he has one of the highest numbers of people on Medicaid of any member of Congress. And a lot of those people are voting for Republicans. They are not just voting for Democrats. Now, I just want to save people's health care. I don't care who the people vote for, but it's important for Republicans to remember that I think they have a conception of Medicaid as like just an urban program for the poor or whatever. That people in this country who are on the Medicaid program are working people. They are working class people. They are people who will not get health care if they do not have Medicaid. And you are basically going to be ripping away a key cornerstone. Medicaid is our largest insurance program. Rural hospitals will die, urban hospitals will die. The infrastructure of healthcare is dramatically undermined. And that's why, the leaders of the hospital associations are coming out guns blazing to say this is going to undermine our entire healthcare infrastructure. It will mean people lose coverage. We have fewer doctors, we have fewer hospitals, fewer clinics, because essentially Republicans are trying to solve their tax program on the backs of working class people.
And one last thing that I want to talk about also in the tax realm, and the reason this makes a difference is because remember, the Republicans' margin in the House is very, very small. It's just a few votes. So if you get a block of even 4 or 5 of them upset and they don't vote for it, this can go down the drain. And one of the things you're going to hear a lot about is salt. It has nothing to do with table salt. Neera, what is that about? And why are some Republicans from blue states very irate about this and may not vote for it because of this salt problem?
Right. So SALT stands for state and local taxes, and it's a deduction that people have historically gotten for their state and local taxes. It makes sense that if you're paying state and local taxes, you shouldn't get sort of doubly taxed in a sense. So it is a way in which when a state government is really investing resources, that people who are paying those taxes get a break. So, so basically the Trump tax cut, the first round, basically took away this deduction. It was a big attack on blue states. If we don't pass legislation at all, basically salt deduction comes back. So the vote right now, Republicans in Congress in blue states, New York, California, New Jersey, etc., they face a choice. If they vote for this legislation and it doesn't have a it doesn't fully put back the salt deduction, they are increasing taxes on their constituents. And
Exactly.
that is 100% wrong. So essentially, there's talk about a $30,000 deduction, a $10,000 deduction, $50,000 deduction. But regardless, pretty much anything they do here will be a tax increase. It's up to them to decide whether they want to increase taxes on their constituents or kowtow to their Republican colleagues. And that's the choice that people like Elise Stefanik, Mike Lawler, and others in New York and elsewhere, Michelle Steele, they all face now.
And that, my friends, may be one of the reasons, in a very bizarre way, that Democrats are able to preserve health care, because those Republicans, only takes a few of them to upset the apple cart. And remember, it's critical to stop this in the House. But I'll have news for those congressmen. They vote for this. They may get hung out to dry because there's no guarantee the Senate will vote for this. So all those congressmen are going to walk the plank. Well, it may get chopped off when those senators get cold feet, like Senator Hawley, and say, I'm not voting for that. So they will have taken the worst vote of their lives for nothing. So, Neera, there is no one who knows this better than you. You are one of the architects of the Affordable Care Act. You are one of the architects in preserving the Affordable Care Act. And for the trifecta, you're going to do it again. So we are
We'll
going
do
to
it
be
together. We'll do it
all
just
right.
like we did it together before.
And all of you contrarians are critical for it. We're going to be sharing the information that Neera talked about with our contrarians. So you will be able to look up and see how many people in your district, and you'll be able to pick up the phone, talk to your congressman or your senator and say, hey, a few 100,000 people in my state or tens of thousands in my district. What are you guys doing? You're taking healthcare away for rich people. So we will follow this. There's no issue more important. Neera, thank you for everything. Thank you for CAP. And we will look forward to having you back as once more we save healthcare for the American people. So see you next time.
Thanks, Jen.
Bye.